There is a new product being introduced at our Women's Health and Lifestyles Fair. It's called MedPack, and you're going to want to hear about this if you take multiple medications. Tim Wright, pharmacist at Wagner Pharmacy in Clinton, is here to show us MedPack, new technology. You're one of the only pharmacists within the area, or the region even, to have this?
That's true. To our knowledge, we're the first retail practice in the state of Iowa to do this.
Because it's a whole different system from what we are used to with when we get all the pills lined up, and a lot of folks have to take multiple medications every day.
Absolutely, and what those people typically do is they'll get their medications in the prescription vial when they leave the pharmacy, and then they'll take them home and they'll organize them into their weekly or monthly planners, depending upon how many meds they have, and it's a very complicated process for them.
And we know sometimes it doesn't work well for some folks.
True.
They miss it or whatever. So show me then what this is and how this is so different.
Well, what you see here is a 1 month supply of medications packaged in our MedPack product. And it's basically a strip of cellophane packages, each individually labeled with with its contents. And here you'll see this patient is getting a Tic Tac and 4 Skittles.
Yes, right. Yes, that is a serious, serious condition right there that needs to be treated with Kit Kats and Skittles. So when you go through this, then this is maybe this is their morning dose, and it's all labeled.
Correct.
Exactly for that. So what do you, as a pharmacist, Tim, have to know about each of these folks to make this happen?
Well, we have to have a lot of patient interaction. We need to know what their habits are like, and we do try to intervene to make sure they're taking their meds at the same time. There's a lot of medications that need to be taken strictly at bedtime or need to have a morning administration time. So we work with them to sort out something that is medically correct and also fits their lifestyle. And it's quite possibly the most powerful adherence tool that patients can get.
Because, so how are they going to be able to tell? What's the easiest way for them to tell how they're doing? It's like, oh, I missed 3 packs.
Well, it's not really possible because after each dose time, it's the morning, they're going to rip off their morning pack, simply tear it open and take their meds, and then discard the rest. And so an enormous amount of patients can't recall whether they've taken their morning meds or not. So
you're going to know.
If they need a review, they can go back.
Like, here's the next one. You see this one. This is your noon one.
Right.
So you took your morning. See, it's just 12 o'clock, and then probably this next one is okay. This is what I'm going to take at 6 o'clock. Yeah, there you go. So this is something that needs to be. I need to be able to trust you.
Right.
Implicitly, and then it's also computerized. So
Absolutely.
We have to trust the system.
Yes. True.
So what do you think is who is the ideal patient for this, for MedPack?
Well, technically anybody could benefit from it, but the patients that we believe are going to benefit the most are, you can imagine, the senior that goes to the pharmacy and leaves the pharmacy with a bag full of 8 or 10 or 12 medication vials. It's a lot of times as pharmacists we almost feel you've already failed on that regimen before you've even left the store, because it's not even manageable by anybody.
Right.
So we think patients with chronic disease we've kind of pegged it at 5 or more medications are going to find the most benefit from this.
Okay. All right, so there's your information, a Wagner Pharmacy. You guys have, did you tell me 4 locations, Tim?
We have 3 locations with 4 pharmacies, 3 retail, and then a long-term care practice.
So for all the folks watching and listening right now who are not in the Clinton area, may they take part in your services of MedPack?
They can. We do have a rural delivery route, so we serve some rural areas around Clinton. We do have a daily run down to the Quad City area, and we're also, if there's somebody that's extremely rurally dwelling and it's not feasible to drive to them, we will serve patients via the mail.
All right, so get online, check it out with Wagner Pharmacy, and look for Tim and his staff at the Women's Fair this weekend. So you're going to be able to explain that more thoroughly, one-on-one. You can go up and talk to him.
Yeah.
Thank you, Tim. Thank you for that.
Appreciate it, Paul.
Very nice, and I'd like to get on the Skittles and the M&M
regimen.
Yes.